Welcome back, everybody. Dr. David Wheeler from Wyoming Medical Center joins us in the studio this morning to talk about National Stroke Awareness Month. Dr. Wheeler, thanks so much for being with us.
Thanks, Zach.
So tell us a little bit about the importance of making May National Stroke Awareness Month.
So stroke is the fourth leading cause of death, but the number one leading cause of long-term disability. However, it's a preventable disease, and there are amazing treatments available if people recognize the signs and symptoms of stroke. So we work along with the American Stroke Association and American Heart Association to celebrate May as Stroke Awareness Month using various tools such as public service announcements, television interviews, stride out stroke awareness walks to raise money and raise awareness so that people are better familiar with the signs and symptoms of stroke.
And tell us a little bit about early detection of some of these warning signs you're talking about.
So it's very important to know what the signs and symptoms of stroke are because there's treatment available, but only if you get to the emergency room in time to take advantage of those treatments. So the major signs and symptoms of stroke include the sudden onset of weakness or numbness on one side of the body, difficulty speaking or understanding speech, sudden onset of severe headache, dizziness, incoordination. If anybody has any of those symptoms, you must call 911 immediately. It's only in the emergency room that we can take advantage of our amazing treatments to help get rid of the blood clot or thing that's plugging up the arteries in the brain that's causing the stroke.
And you said earlier that stroke is a major cause of death here in the United States. What are some risk factors that might lead somebody down to having this be a real possibility for them?
Great question. So stroke is a preventable disease. So some of the modifiable risk factors that people should be aware of, number one on our list is smoking. So if you smoke, please quit. Being aware of your family history. Family history definitely increases your risk of stroke. Knowing what your cholesterol numbers are, your blood pressure numbers, getting regular exercise, eating a healthy, balanced diet, and working with your doctor to control your modifiable risk factors.
And say you're with a loved one or a friend and you or that person is having stroke-like symptoms. You think they might actually be having a stroke. I know it could be a very frightening scenario, but knowing what to do could really save a life. So tell us what somebody should do in that situation.
Well, here's a simple algorithm for you to think about. Think of the word FAST. F for face, so ask the person to smile and see if their face is crooked. A for arms, have them hold their arms up in the air, and if one of the arms drifts down, that's important. S, speech, ask them to speak, repeat a phrase and speak to you. If their speech is slurred or doesn't make sense, then time is brain. Call 911 and get to the emergency room as quickly as possible.
All right.
So remember to act fast.
A great acronym to kind of help you through that scenario. Now, where can we go for more information?
Well, you could visit our website at wyomingneurology.com. You can call our office at 265-4343, and we invite everybody to come down to our Stride Out Stroke 5K walk run on May 11th, Saturday morning, 8 o'clock at the Tate Pump House.
All right. Well, Dr. Wheeler, thank you so much for coming in and telling us all about National Stroke Awareness Month.
Thank you.